Hello, my dear subscriber. My name is Dr.Naumchuk. I am a urologist surgeon, and I am glad to welcome you to my channel, Urologist Naumchuk. Today we are going to talk about something called heparin ointment. I will now tell you about the composition of heparin ointment, and after that I will explain how it is used in urology for men. And if you understand the composition of heparin ointment from the start, then you'll understand what its benefits are for you. Well, in general, I'll explain everything. Look, the main component of heparin ointment is heparin. Heparin is an anticoagulant that affects blood clotting factors, specifically by preventing the formation of blood clots and promoting the dissolution of fibrin, which is found in the blood vessels. In simple terms, heparin causes blood clots to dissolve. The second component of heparin ointment is an analgesic substance, benzocaine. And often heparin ointment is used for bruises, contusions, and injuries. So it can be considered both a pain-relieving medication and a remedy that dissolves blood clots, and simply put, also helps bruises to fade. The third component of heparin ointment is benzyl nicotinate. This is a substance that dilates blood vessels, which improves blood circulation at the site of application. In other words, where the ointment is applied, and as a result, healing and blood flow in that area are enhanced. The composition also includes petroleum jelly, peach oil, and glycerin. These three ingredients help the ointment spread more easily onto the area where you want to apply it. The first thing to note is an open wound, because if you apply it to an open wound, bleeding may simply start from there, since the ointment works by dissolving blood clots. Yes, it dissolves blood clots. And if you didn't know, whenever there is an open wound, even a simple cut, blood clots form there. Heparin ointment, on the contrary, will remove them. That's why you must not apply it to an open wound. And if you are allergic to any of the medications I mentioned earlier, benzyl nicotinate, heparin itself, or benzocaine itself. If you are allergic to these medications, you must not use it. If you have problems with blood clotting, if your coagulation test results are poor, when is heparin ointment used? Heparin ointment is used for bruises and contusions. Heparin ointment is used for soft tissue injuries. Heparin ointment is also used for women with lactostasis during pregnancy. And heparin ointment is used for varicose veins of the lower limbs. Heparin ointment is also used for hemorrhoids. Guys, what is the connection between heparin ointment and urology, and how can it directly affect improving erections, potency, and your ability to get hard? Look, it's very simple. All the components of heparin ointment that I mentioned above directly contribute to vasodilation, improved blood circulation, and the prevention of blood clots. Accordingly, you all know that the penis, the body of the penis, is made up of the structures I mentioned. I've already explained before that these structures actually look like honeycombs, and these cavernous bodies fill with blood during an erection. So what happens if you use heparin ointment? The blood filling of the cavernous body improves, the blood filling of the cavernous body increases, and as a result, the erection becomes firmer and lasts longer. In simple terms, heparin ointment for men increases potency. How should you use it? First of all, you shouldn't use it for more than 7 days. That is, you can use it in courses, but it's best to consult with me beforehand. By the way, if anyone needs a consultation regarding urology, you can write to me. The link will be below. I'll consult you and explain everything, what to do and what not to do. And please don't self-medicate. How should men use heparin ointment? To improve erection and potency, for 7 days, apply a small amount of heparin ointment to the shaft of the penis about 3 times a day. Do not rub into the head. Under no circumstances should it be applied to the mucous membrane. Just apply it to the shaft of the penis. That's all. After 7 days, you may notice a certain benefit. Accordingly, this advice is for people who are already doing well and just want to improve. But if things are really bad and you have no erection at certain times due to psychological factors or hormonal imbalances, then heparin ointment will not help you. Right now, we are talking about people who are already doing well in this regard. Therefore, you should not overuse heparin ointment. You can find out the dosage and duration of treatment from your urologist, or you can contact me for a consultation. If you have any questions, feel free to ask. Leave your questions in the comments and I will definitely answer them. And from you, I'd appreciate a like and a subscription. Have a great evening, everyone. Bye-bye.